Hi, my name's Mike Masling. I'm a consultant physician at Poole Hospital. The aim of this film is to explain about our Inspirational Postcards Scheme. This was something set up by my colleague Joe Dalton, who's one of our diabetes nurse specialists. And it's something that we feel that could be used not just in diabetes, but in lots of other healthcare settings, particularly for patients with long-term conditions, but perhaps other healthcare settings where you would like to remind a patient that they need to do something, perhaps after discharge or after you've seen them in the outpatient clinic. So Joe, if you could explain to us how the scheme works.
What we've got is 10 inspirational postcards, and you'll be able to see them close up at the end of the film. And at clinic, we're talking to people about positive self-cares, and we want young people to maintain those self-cares when they get home. And what we found was that after the first couple of weeks, the novelty can wear off. And so what we've asked is for people to write themselves a note to self using one of these inspirational postcards. So at the end of clinic, they can choose a postcard to write to themselves. And what we're saying is, put hello and whatever your first name is at the top and put today's date. What I also do is put a smiley face sticker in the corner where the stamp would have gone if you were going to post a postcard normally. What we then do is we think of a positive comment that the young person or I will write on their postcard if they're not terribly good at handwriting. We then focus on 1, 2 at the most positive self-steps that they want to remind themselves to do in a couple of weeks' time when we post the postcard to them. And they need to be quite smart goals, not something really vague like sort out my diabetes, something that's quite specific and can be helpful. When we've got our 1 or 2 notes to self, we then finish off with another cheerful or hopeful comment, and then both myself and the patient will sign the card, and it's a bit like a sort of homeschool agreement that you might get with a child at school and parents and school staff. What I then do is I put the card into an envelope so that nobody at home can read what the young person's written on their postcard, because it might be something quite personal, and I'm then going to post it to their home address in 1 to 2 weeks. And it's really nice for the young person to receive a cheerful piece of post, and it helps to remind them to do that positive self-care.
And Joe, we found this to be very effective with our patients. We have audited it and made an evaluation of it and found it very effective for our patients. What do our patients particularly like about it?
What they like in particular is that they've received something from us. And a really, really lovely comment was that folk found that it was nice to know that we were thinking about them even when they weren't in our clinic. And because we asked them to put the postcard somewhere where they'll see it every day, it's a sort of aid memoir to do the thing that they know they probably should be doing in terms of diabetes self-cares, and that's really positive. When they come back to clinic in a month or 2 months' time, if things have gone really well, what they may then do is pick a different postcard and write themselves a new note that we then post out. So some of our young people have got 2 or 3 of these postcards, and they've worked really, really well.
So we feel this is something that we could do in any healthcare setting. We would advise you just to give it a go, and hopefully you've seen from today's film a framework of how you could use it. Good luck.